Some scientists call the heart the second brain of the body, and like the brain, it has its own electrical activity. The heart is a muscular organ with 4 chambers. Blood collects in the heart's 2 upper chambers, or atria, before filling the 2 lower chambers, or ventricles. When the ventricles contract, blood in the right ventricle is pumped to the lungs, and blood in the left ventricle is pumped to the rest of the body. The heart has a natural pacemaker called the sinoatrial node, or SA node. The pacemaker controls the heart rate by precisely determining when the muscles of the atria and ventricles contract. The electrical signal produced by the SA node reaches the ventricles through a narrow pathway that includes the so-called AV node and bundle branches. Taken together, these pathways are referred to as the conduction system of the heart. But what happens when this rhythm slows down or becomes irregular? That's where a pacemaker comes in. Sometimes, due to aging, heart disease, or other conditions, these signals weaken or become irregular. This can lead to bradycardia, when the heart beats too slowly, causing dizziness, fatigue, or fainting. Heart block, when electrical signals don't travel properly through the heart. Arrhythmia, when the heartbeat is irregular, either too fast or too slow. Before the procedure, your blood and urine will be tested. You will also have X-rays taken of your chest, and an electrocardiogram, or EKG, will record the electrical activity in your heart. A local anesthetic will be injected into your skin to numb the area where the pacemaker will be inserted. The surgeon will make a small incision beneath your collarbone. The pacemaker's leads will be inserted into the subclavian vein and then threaded toward your heart until they reach the right atrium. Your surgeon will view X-ray images on a video screen to position the leads correctly. Once the leads have been tested, they will be connected to the pulse generator. The pulse generator will then be placed in a small pouch that your surgeon will create under the skin beneath your collarbone. Your surgeon will then sew the incision back together. While you're in the hospital, your doctor will monitor your heart rate and blood pressure to be certain the pacemaker is working properly. The pacemaker apparatus consists of a small battery-operated pulse generator. A pacemaker battery usually lasts for about 8 to 10 years. The pulse generator recognizes an abnormal heart rhythm and responds by sending electrical pulses to correct it. Once the rhythm is normalized, it stops sending signals. The pulse generator is programmed after implantation of the pacemaker according to the individual needs of the patient. Before you leave, doctor will make final adjustments to the pacemaker settings. After your procedure, over-the-counter pain medications, such as acetaminophen or ibuprofen, should be sufficient to relieve any pain. You will not be able to drive for about 2 weeks. Periodically, you will need to follow up with your doctor to test and adjust your new pacemaker.